Dr. Hadian, thank you so much for joining me today. So a lot of the work you do is around patient involvement in critical care. Can you tell me what you've learned from a conference like MedX?
Well, thank you for having me, by the way. It's been a pleasure to attend this conference. It's been on the cutting edge of patient involvement, patient advocacy, and partnership of healthcare provider with patient and their family. And I think that's the cornerstone of medicine and where it should go.
Have you taken anything away from this conference that you're going to bring back to your own work?
I think what is important, and I learn, and I'm very happy that a lot of doctors and patients are involved in this, that you have to form a partnership with the patient and the family to get the best outcome. And I think that's what Medicine-X is about and is trying to send a message to the rest of the healthcare systems. And I'm so glad to be here.
Do you think that the message that Medicine-X has propagated is really going to take hold in the healthcare system?
I think it eventually has to, because once the patients are becoming, we are entering an era of electronic and technology, and a lot of patients are very savvy, young generations, they know how to navigate data. And I think, and with the recent changes in healthcare, that quality care is more important than the quantity of what you provide. People and patients are more in tune with what they get out of their healthcare system, and I think eventually it's going to lead that direction. Now the question is how fast you're going to go to that direction, and we are hoping by spreading the words around, we get the people more involved in their healthcare. Like in my line of work as intensive care medicine, you usually don't plan for your critical care. Something usually bad happens, God forbid, and you end up in ICU or your loved one. And then that's the time then you realize, oh my God, what is the words of intensive care medicine? So specifically, like in my organization, we're trying to raise awareness about ICU care, making sure that every hospital is following some standard of care. And once the patients and the family and the public are aware of what the standard of care is, then organization will drive to that. So I think that's the message of Medicine-X, obviously in different area of medicine, outpatient, inpatient, but that's eventually going to happen. We're just hoping that it will be faster than the rates that we are right now on.
And get patients involved sooner rather than later.
Exactly.
That's excellent. Well, thank you so much for speaking with me.
Thank you very much.